Should you get the flu shot or not while taking prednisone? It's a really important question because many of us know prednisone is an immunosuppressant. Is it even going to work? Is there any point in taking it? I've gotten a lot of questions recently because it's flu shot season around and people want to know what to do about the flu shot while taking prednisone. And I have to give full disclosure here. I have given thousands of flu shots as my time as a board certified doctor of pharmacy and third generation pharmacist. I've also taken prednisone and I've also gotten the flu in the past when I didn't get the flu shot. So I'd like to give you that full disclosure so you know exactly what kind of person you're listening to. So in this video, I'm going to answer the top questions people have about the flu shot and prednisone and help you know what to do about a few other vaccines too. All right, so the specific question that triggered this was, because I was on prednisone for 6 months, should I get a flu shot this year? And because you were on prednisone for 6 months, you should get a flu shot this year. And there's a lot of reasons for that. So back to the fact that prednisone is an immunosuppressant. We'll get into how well the flu shot works, but the reason why you should, because you're on prednisone, is because the number one most likely infection that you will get due to the suppression of your immune system that is the most likely to lead to death as well is pneumonia. You are 5.42 times more likely to get pneumonia than someone in your exact same situation who hasn't taken prednisone. Pneumonia, especially in older adults, is very likely to lead to complications, hospitalization, intubation, emergency room, ICU visits, and death. And so we don't want any of those outcomes for you. We want to do whatever we can to prevent that number one most likely infection while taking prednisone. So in addition to the flu shot, I would also recommend other shots like the pneumococcal vaccine, Pneumovax, and others that help prevent pneumonia. Talk to your doctor about which of those you're eligible for, but the most likely risk for you is pneumonia. We want to prevent that. The worst outcome for the flu is getting pneumonia. So let's not get pneumonia and die. So back to the immunosuppression and is the flu shot even going to work? So if you're taking prednisone less than 20 milligrams, the CDC says just take it. You're not their definition of immunosuppressed. If you've been taking prednisone really long term at really high doses, then you are technically immunosuppressed. And they still recommend you get it. It's just they have this caveat. It may not work as well for you. Your immune system may not be able to mount as good of a response to the vaccine as it otherwise would if you weren't taking prednisone. But the benefits of preventing flu pneumonia definitely outweigh the risks for people on prednisone. Discuss it with your doctor, make sure it's right for your exact health situation. But for most people on prednisone, this is your highest risk outcome. And so you want to avoid that by getting the flu vaccine. What if you're only on prednisone short term? When should you get it? So this is addressed by the CDC. They say that if you're taking less than 20 milligrams and the whole time you're taking it is going to be less than 2 weeks, right? So some 14 days or less of therapy, then it makes sense to wait 2 weeks after that before you get your flu shot. So if your doctor prescribed prednisone 10 milligrams for 10 days and you start it on September 1st and you go all the way September 10th, then you'd wait 2 weeks. So you'd wait until September 24th or sometime that week until you'd get your flu shot. And then your immune system will be in the best situation to mount an appropriate response to the vaccine to give you the most protection. Speaking of September and October, is there a better time to get the flu shot? So if you're over age 65 and or you're taking prednisone, it's best to get the flu shot sometime in either September or October, according to the Infectious Disease Society of America. According to my pharmacy school professors, you should get it in October. According to my immunologist, you should get it in November. So sometime September, October, November is best. And why is that? Because the flu season usually starts ramping up in November and ends sometime around April in the Northern Hemisphere. And so if you are getting the flu shot in July, the flu shot itself only lasts about 6 months. So it's going to be wearing off in like December, January. And then you're not going to have coverage for those last few months of flu season. So you want it to cover the whole flu season appropriately. So sometime late September, early November, in that range is a good time to get the flu shot. Another specific question I received was flu shot and COVID combined okay to take if on prednisone? So great question, because COVID pneumonia kills people on prednisone too. RSV pneumonia kills people on prednisone. So both the flu shot, the COVID shot, and the RSV, or respiratory syncytial virus shot, are all great options to support you while on prednisone to prevent pneumonia, lower respiratory tract infections, and they are fine if given all at the same time on the same day. If you need to get them, you can either do 2 separate arms if they're for some reason separated, or they can be an inch apart on the same arm. Either way works fine. If I was eligible for all 3 shots, I would want to get them all at once, because one doctor's appointment or visit to where you can get a shot at the pharmacy, and only one time dealing with the side effects. Like, oh, who wants to feel yucky and down for a few days while your immune system is making that immune response? And that's not the flu. When you get the flu shot and you feel achy, miserable, you might even have a minor fever, those are not the flu. Those are actually the symptoms of your body turning on the immune system, making antibodies, and having a good response to the vaccine. And if you hate feeling that way, I have a free downloadable checklist of things you can do to minimize vaccine side effects. Just click the link below and you can get access to it right away. So what is the best dose of the flu shot? There are several vaccines of flu shots that are available. There's a live attenuated influenza vaccine that is a nasal spray. This is not appropriate for people on prednisone. You need to avoid live vaccines while on prednisone. Then there is a normal dose injectable vaccine. That is perfectly fine for most people on prednisone. And then there's the high dose vaccine. And that's best for people who are older, whose immune system, just by virtue of age, has decreased. So the higher dose of the vaccine helps the immune system to respond better. So if you're over 65, the high dose vaccine is best for you. But any dose of the injectable vaccine would work for people on prednisone of any age. Now, I just mentioned one of the most important things to avoid while on prednisone, and that is live vaccines. If you're worried about other things that you need to avoid while taking prednisone, then you should check out this video. It's the 7 or more things to avoid while taking prednisone. You learned about just one of them. There's even more that you need to understand and implement to keep you safe and have the fewest side effects while taking prednisone. Watch it now. And if you haven't already, subscribe to the channel to get more helpful information like this about prednisone. Signing off as Dr. Megan, your prednisone pharmacist. Watch that 7 or more things to avoid video now.